Okay, everybody, and today I am happy to have with me Hunter Singh, and he is going to be talking with us about a couple different things, primarily his own experience with having some family members with autoimmune conditions, and also talking with us a little bit about AI and how that can help with health challenges, which should be interesting because you've probably heard that AI is pretty much starting to explode and go everywhere. And then we're also going to talk about his business and his mission to help people live up to 10 years longer with longevity, and how that relates to autoimmune and some of that kind of stuff. So welcome to Autoimmune Rehab, Hunter. So why don't you start off by telling us, short 30, 60 seconds, who are you and what brings you onto the podcast today?
Sure. Again, my name is Hunter Singh, founder of Longevity Health. Thanks for having me on. I spent 20 years on Wall Street in my younger career, focused on healthcare, consumer, and technology. And I was always into health and wellness. I was an avid cyclist, but suddenly my father died at age 65 of pancreatic cancer, which started in the head and shoulders, which was largely preventable. It eventually would have got him, but he could have lived a longer lifespan. And I also lost 4/5 friends to various cancer-related diseases. And my brother lost both his kidneys due to Goodpasture syndrome, which is a very rare autoimmune disease. And it was somewhat preventable had it been detected earlier. He could have saved his kidneys. That just frustrated me. So I decided I really wanted to help others get healthy. I always love getting people out on the bike and running and exercising, and because I know how great it is to be healthy and fit. So I started a foundation called Charity of Choice, and I put on large cycling and running events all around the country largely for preventive health and cancer research. We partnered with Livestrong. You remember the yellow bracelets?
Oh yeah, for sure, absolutely. Yeah, that was Lance Armstrong's thing. Yeah, initially. Yeah.
Love him or hate him, he did amazing things for cancer survivorship. Not for research, but for survivorship. Because when you get cancer, just people don't know where to go, where to turn to, and the same thing's going on in our healthcare system. As you mentioned to me, before our call started, that there's very little done in prevention to get in front of disorders. And the current medical system doesn't support it. So people are kind of waiting till after the fact to have a problem to fix it.
Absolutely. And your typical autoimmune patient, and the majority of people listening to this already knows this, takes them at least 3 doctors just to even get a diagnosis, and 3 is small. So I've talked to some that visit up to 10 different doctors. They run a billion blood tests, sometimes urine tests, poop tests, whatever else tests. And at the end of the day, by the time a lot of these people get diagnosed, they're either already very deep into being quite sick and dysfunctional. Some are either already on disability before they can even get a diagnosis. And it just becomes a big circle and a big mess of, oh, well, now you've got this diagnosis. Let's try to see if this drug will fix it. Or, maybe let's give you this diet and hope it does something. And sometimes if you're lucky, it might help. But a lot of times, people just get stuck in this cycle of, we didn't get a diagnosis soon enough, kind of like what happens with cancer. By the time a lot of people find out they have something like RA or lupus or, even things like Hashimoto's, Graves, some of these autoimmune conditions, they're already experiencing really severe symptoms when, potentially they could have been diagnosed much sooner before it became basically wrecked their life, essentially.
Yeah, I mean, we'll get into AI later in the call, but I think Dr. House is out of business because I think AI can analyze data much more effectively than clinicians and doctors, and much quicker based on your own biological profile or what's going on in your system. Of course, it'll always have to be checked by physicians, but I think AI is going to make some huge changes there, and we can get into that later.
Yeah, for sure. Absolutely. Yeah. So you started this company, Longevity Health, and, obviously the tagline here is live longer, live better, physician-led, customized longevity plans tailored to your biology. So, I find that really intriguing, especially given that, let's face it, your typical autoimmune patient, let's assume you've gotten a diagnosis. Let's assume you're even working with somebody that has some kind of functional medicine knowledge. A lot of times they're still just kind of somewhat guessing, and so are you, when it comes to what kinds of supplements they should give you, what kind of diet you should follow, all that kind of stuff. So I find the idea of the customized healthcare really interesting. What's the approach there with you guys, and how do you guys figure out, what kind of customized healthcare to give somebody?
Great question. So we're kind of in three parts. Our phase one for the last 2 years, we've built Longevity Health, and we charge. It's a program. It's an online concierge program, similar to if you go to your local doctor who does concierge, or you could even go to Peter Attia, who you saw in 60 Minutes last week, who charges, I think, $175,000 to go to one of his clinics. Most of these clinics cost somewhere between $30,000 and $50,000.
So they're really created for the millionaires. That's the other issue too, is they're not created for your average middle class person that gets sick and can't afford, thousands and thousands of dollars.
So we have a product that we call the Billionaire Bundle, and it's what a billionaire would get. It's not cheap. It's $11,000 a year, but we do. We first start with a consultation with a doctor on the phone. We have 4 doctors in our practice. One of our co-founders is a doctor, and it's really like, Anna Laura, why are you doing this? What's going on in your life? It's a conversation. It's, my parents had this, my mother had this, my father had this, I'm going through this, I'm worried about this, I've had a health scare. And then we look at your individual self based on what is next. So what is, what's going on? So we test. So we do a comprehensive blood test, a DEXA scan, which is bone density and visceral fat. It only costs $75 for a bone density test. Every woman over 40 should get one, every man over 45. We do a sleep study, a glucose monitor, a VO2 max test, which is not just for athletes. A higher VO2 is very indicative of longevity and health span. And then we do a gut biome test. And in some cases, we do genomics, okay, depending on what the patient wants. All those tests are included in the program. And then we analyze all that data and look across the tests based on your biological profile, not Hunter's, but Anna Laura's. And then we develop a plan, and then we have accountability. So we follow you. We give everybody a Slack channel or text or email, and there's constant interaction with an executive medical board, which includes a doctor, a clinician, a exercise physiologist, and a dietitian. So it's a lot. And we've done a little over 100 patients through the program. And I can't say we've prevented any autoimmune diseases yet, but not that they're preventable, but we've gotten in front of a lot of health conditions for people, and we've created change. That's where it comes into accountability. So people are changing their diets, they're changing their exercise regimen. So it's a very effective program. Most of the people that have had it for a year are renewing. That's the basic flagship product. Our next version of that is AI plus human in the loop, which will do everything we just said, but for $1,000 a month, $1,000 a year.
Wow, yeah, that's really amazing, because if you think about it, $11,000 a year seems like a lot, but for some people, especially if you've been forking over a lot of money for functional medicine and supplements, and you've been doctor after doctor after doctor, even if you have really good insurance, maybe you're not paying, maybe not $11,000 a year, but you're still paying a significant amount of money out of pocket in most cases. And wow, $1,000 a year with AI, that's interesting. So tell me a little bit more about that AI one. How does that do things?
Just backing up for 1 second, you mentioned reimbursement and you mentioned all these tests. There's so much going on in the longevity space right now. By the way, longevity isn't necessarily living longer, it's living better. America spends something like $2 trillion on end-of-life care from Medicare, which can be largely prevented to better health. And maybe you don't live as long, but you die quicker, right? As opposed to these prolonged deaths from diabetes and disease and all this stuff. I wouldn't say it's cancer preventable, but if you could catch it earlier, or these autoimmune diseases that you know so much about, if you catch it earlier, you may or may not live longer, but you're going to live better. The problem right now with all this functional medicine is threefold. One, there's just too much advice. There's so many tests out there that you can get, which are wonderful. Get a blood test, buy some supplements, right? Hypobaric oxygen chambers. There's peptides are coming on the scene, right? All these products, like you go get a blood test at Function Health, and you can buy some of their supplements or Superpower, and they're wonderful tests. But I think everybody's biological profile is different, and you also need much more longitudinal data than just a blood test. So too much advice, too many tests. And then the other thing that you mentioned is that the medical system doesn't pay largely for these tests yet, but I think it's going to change as more and more of these tests come to fruition, and companies like us can prove that we can get in front of disease and change people's outcomes by using the data. So I think yeah, but your doctor doesn't want to look at this stuff. You live in Utah, you're probably a skier. If you walk into a ski shop with your boots and your bindings and your jacket that you bought on Amazon and said, hey, mount my bindings. Oh, by the way, my zipper's broken. Can you fix my zipper for me? I'm like, you bought all this stuff on Amazon. It's the same as walking into a doctor with your blood tests and your DEXA scan and like, here, Dr. Brown, what do I do with all this stuff? And then she's going to say, listen, I didn't order this stuff. I don't get paid for this stuff. So you follow me?
Yeah, absolutely. Yeah, it's definitely a battle for sure that absolutely needs to change. But like, again, you mentioned the whole longevity thing. The average person gets diagnosed with an autoimmune condition when they're in their 40s.
Yeah.
And let's say you're 40 and you get this autoimmune diagnosis, but you still live into your 90s. But those last 50 years of your life are, spent going to the doctor every 3 months for another blood test, and then trying to slap different drugs and supplements, and you trying to change your supplements, but then you still can't really do things. You can't travel because you feel too sick all the time, all these other kinds of things. What's the point?
So we talked about AI, and AI everyone's talking about AI. AI is not fully ready yet, but I think in 5 years, your AI will replace your primary doctor.
Interesting. And what makes you think that, out of curiosity?
Because it can prescribe medicine, it can order lab tests, it can make referrals, introductions. It's so much it can do. There'll probably always be a human in the loop. It's not ready for 3 reasons. AI hallucinates, it makes mistakes. People are not ready for a driverless doctor yet. People still want a human in the loop. We know that. Maybe in San Francisco, because I feel safer around a Waymo than I do you driving your car.
Yeah.
Kansas, and if I live in Kansas City and I've never seen a Waymo driverless car, I'm going to run for the curb, right? The regulatory environment is not fully ready yet. Right, but that's going to change. So what we've done to reduce costs, and I mentioned $1,000 a year, $100 a month, is you can store all your data on our AWS server, which is a highly secure HIPAA compliant server. All your tests, you can download any tests that you've had done. We can order additional tests. Once your tests are in there, the voice agent you can talk to, which I'll call right now, will analyze your data and make recommendations and develop plans for you. And then a doctor will check it. So it's AI plus human in the loop. So we're just going to call it real quick. I've already done my consultation, so it knows me. I've had a lot of conversations with it. So it might hallucinate a little bit because I call it so many times a week.
That's interesting. Let's see what this
give it a call, and I'm going to ask it about my VO2 test, and we'll see if I had a VO2 max test recently.
Hello, this is Jesse from Longevity Health. How have things been going for you?
Pretty good, Doc. My knee is feeling better. My back's a little bit sore. I fell off a ladder yesterday, so let me know if I should do anything for that. And then in the meantime, just pull up my VO2 max test and just share with me my results, and remind me what I need to do to get my VO2 max up. And also, what is VO2 max anyway? How does it affect longevity?
It's good to hear your knee is feeling better, but I'm sorry to hear about your fall from the ladder. A sore back can be quite uncomfortable. For now, I'd recommend resting and applying ice to the area. If the pain persists or worsens, or if you experience any numbness or weakness, it would be best to consult with a doctor to make sure everything is all right. Regarding your VO2 max, I recall we've discussed this before. Your last VO2 max test from July 11th, 2025 showed a peak of 45.4 milliliters per kilogram per minute, which is a really strong result for your age. To help you understand it better, VO2 max is essentially the maximum amount of oxygen your body can use during intense exercise. It's a key indicator of your cardiovascular fitness and overall aerobic endurance. A higher VO2 max is strongly linked to better longevity because it reflects a more efficient cardiovascular system, which can reduce the risk of heart disease and other age-related conditions. To improve your VO2 max, we've talked about incorporating high-intensity interval training or high ICE into your routine. This involves short bursts of intense exercise.
Anyway, you get the idea. If
Yeah.
So all my blood tests, every test I've ever had done in my life that I have, I can take a picture of a PDF and put it into our system. It'll analyze the data and make recommendations. And it's getting better. It's like I said, the doctor's still in the loop, but the idea is to take AI to look across all of everything, DNA, RNA, whatever is in there, and it analyzes the data. And then the doctor checks it. So with a $100 a month program, you get a doctor. We don't pay for the tests. There's a $200 a month program where we have some tests, and a $400 a month program that we also provide some tests. And by the way, you can send it around to your listeners, but our website is longevityhealth.me. And the
Okay, yeah, awesome. Yeah, we'll definitely include that in the link. Yeah, that's interesting. And what I find appealing too is, you know, I mean, you can upload lab tests and things to other AIs like ChatGPT, but of course there's no doctor involvement, and the security of it's questionable as well too. So you guys have incorporated more of like the HIPAA compliant security, so people aren't just uploading their health data to something like ChatGPT and hoping that it doesn't end up on the internet somewhere.
Yeah, it is kind of scary, isn't it? And there's always risk for all these platforms. You know, there was a huge health breach back in January, but we use a company called Healthy, which is similar to Epic or Cerner for housing data. And there's always risk of breach, but or these companies go out of business, and where does the data go? But I don't know. Your generation and mine worries more about it than younger generation.
Yeah, I think they do. That's true. But, you know, I mean, it's still something to think about. So you mentioned you think in about 5 years it's going to completely replace the doctors, like with prescriptions and everything else. So how do you see that happening then? I'm just curious.
So I think it'll take the regulatory environment to change, and we're in early discussions with Singapore, Israel, and maybe Taiwan to test this. So when you need medicine, it will prescribe the medicine, and your prescription, you'll just pick it up at CVS, right? It can order your lab tests. So a lot of these tests need to be prescribed by a doctor. But why do you need a human? I feel sorry for any human these days. I mean, you see yesterday Amazon's building these robots that are going to fill boxes, like human robots. It's kind of scary. We're all being replaced, right? The buggy whip is going away. I'm sure people will adapt, but it'll reduce so much cost. And then if we're correct about the data that we're using, it will save so much money in insurance. You're not gonna have to worry about, you know, what's going on in DC right now, because we're gonna save trillions of dollars in the healthcare system. And I heard once that there are $3 or $4 trillion of insurance reserves. Insurance companies and public companies that are self-insured have to reserve money for healthcare, and they're over-reserved right now because there's so many sick people. And if we can reduce the amount of sick people, reserves will come down and money will flow back to consumers in terms of lower insurance premiums. So not really answering how AI, it's not really AI doctor related, but using data and then building systems for accountability to change behavior will change healthcare in society. And AI can do that. AI can do amazing stuff. And not just AI, but technology. Just say that you're diabetic and you're a vegan, right? And you got young kids want McDonald's, crappy food. It's cheaper to eat food at McDonald's. You're driving by McDonald's and it says, sorry, stop. Your check engine light goes on, your warning light on your app saying a mile down the street is a healthy food vegan restaurant in your local neighborhood that's offering 50% off for you and your family. Or you're walking through Whole Foods and which is very expensive for most people. And it develops a menu plan for you and gives you discounts from vegan health suppliers and a menu. Get financial incentives. Then we can get into social incentives for people using AI and technologies such as gamification. So, women's of Salt Lake City over 50 with osteoporosis, right? Working out together, building our bones together, social stuff like Facebook, Strava, or, fat men over 300 pounds, right? And when you get to 275, you get kicked out of the 300-pound group, right? And so on.
Yeah.
So make it fun and gamify. Your check engine light comes on. It knows you're traveling. It knows you're going. Or you just say, hey, listen, I'm going abroad. I'm going to France for 2 weeks. I hate the food. What should I eat? Where should I go? Boom! It develops places for you to go. And when you're not behaving well, it's going to warn you. Hey, Anna, off the biscuits.
Yeah, that's funny. Yeah, because
make it fun. Make it fun.
Yeah. Yeah, absolutely. And I mean, it's already, I think a lot of people have tried this. I've tried this for sure. You can even just go to Chat GPT these days and say, hey, I can't have gluten, dairy, sugar, and I don't like to eat red meat. What should I eat for the next 2 weeks? And it develops this whole meal plan right then and there for you. So yeah, we're starting to see,
a lot
AI.
of what we're doing, as you mentioned earlier, you don't need us. You can do it on your own. You can throw everything into Chat GPT. You can build plans. A lot of people do that. It's a lot of work. And that's why ultimately we want to charge $10 a month for this.
Wow. Yeah.
So because it organizes everything, it'll have all the discounts and the motivation. And like, instead of going to Function in Health and spending $500 for a blood test, and they do some pretty good stuff with the, they give you a clinician, they tell you what to do. It's just a blood test. But why spend $500 when they're paying $100 for the tests? So everything that we do is passed on to you, $10 a month. 1 billion people on the platform globally. $5 for companies, $10 for individuals. You own all your own data. You control your life. It's all organized for you. Or just do it on ChatGPT and build your own plan, which you can.
You can, but you pretty much also at this point have to have the paid plan to do it too. So, definitely give me more than $5 a month. So that
Spotify, I can listen to my own music, but I love Spotify. I love, satellite radio because it's all service. It's a service. It's a service. That's ultimately where it's going. Yeah, it's going to change.
Yeah.
It's going to change healthcare. And my mission and vision in life, or mission, is to change the nature of preventive health by using all this data and using it to hold people accountable and to give them incentives and motivation. So I could give a rat's ass about this government crap going on. It's like they're all focused on the wrong things. The Democrats just want to give more money to sick care. So I'm kind of siding with the Republicans in that sense. But even the Republicans are off. Although RFK is sort of kind of getting somewhat ahead of the curve on preventive health, reducing drug care costs, and insurance is ridiculous. Insurance loves sick people in America. They love sick people because Medicare. My mom took 5 years to die. It costs probably $1 million to the government when it could have cost $200,000 because she was sick and didn't take care of herself. So anyway, off the political bandwagon. But I laugh every day at this government shutdown because you're all focused on the wrong stuff.
Yeah, they are. They're all focused on the wrong stuff. And the preventative, like you said, is really big key. So let's, come back to, I guess we will 2025 now. And let's say somebody's listening to this and they, they're thinking, okay, all these different programs sound great. Maybe they have the budget for some of them, maybe they don't. What would you say is a first practical step somebody can take to say, okay, I want to see what AI can do to help me, whether that's evaluate the labs, whether it's, what practical step would be the first thing somebody should do to determine, okay, how is AI going to help me right now in the moment, whether they've got a diagnosis, whether they don't, whatever situation they're in.
Yeah, I would recommend maybe don't download your health records, your HIPAA records into ChatGPT unless you've got a disorder and you want GPT to look at it. Just you mentioned for security purposes. Also, HIPAA data is somewhat rear view mirror. I would recommend 3 tests that everyone gets. I would do a blood test, about 50 or 60 biomarkers. I don't think you need 150 biomarkers. I would do a DEXA scan, which is bone density and visceral fat. That's about $75.
Yeah.
And I would also do probably a VO2 max test. If you're concerned about your insulin levels, I would probably just try a glucose monitor. We use Stello from Dexcom. And, for 2 weeks to a month to see, where your insulin levels. Then throw all the data into ChatGPT and put it all in once. Do it yourself and see what it spits out for you.
For sure, absolutely. And obviously, I noticed you guys offer free consultations, so we'll link to that. So if somebody wants to consider working with you with any of the programs, whether maybe they do have the budget for the more expensive one or they want to try out the less expensive one, they can get all the details.
The one I showed you with the AI is in beta right now, and it's a paid trial. And it's AI. I'll send it to you. AI.longevityhealth.me, and that's $100 a month.
Yeah.
And we might have a few spots.
Maybe worth it. Yeah.
Yeah.
Yeah. Good one.
But the idea is like one test doesn't fit all. So hopefully we get people on the program, and you just keep testing, and some new test comes along, and you'll call us through our app and saying, hey, I'm thinking about getting this genomics test. I just got quoted $3,500 for a genomic test. So we have a supplier for $500. So we just pass it through, right? So just keep adding your data. The more data you have in there through your lifetime. I mean, like I said, 1 billion people, every man, woman, and child should have a product like this from birth till death, right?
Yeah.
Imagine when your parents are aging, that you've got all their data, and eventually they just give you power of attorney, and everything's in one place. You've got all their stuff, right? When medications mom takes, when she wakes up, their diet, right? When the caregivers come in or she goes off to her nursing care facility, it's all managed. And they're communicating with you. I don't know if you've lost any parents, but when my mom passed, it broke up our whole family because everybody was fighting over what to do. There was no system on my mother's data, and she kept getting misdiagnosed, and she booted around the healthcare system. It was miserable. So, yeah.
Yeah, and I think just kind of like you've said, I think the biggest benefit to this, whether it's, somebody that's got something like cancer or it is an autoimmune condition, that with this whole AI stuff is, your average doctor's office, and especially if you've been to multiple doctors for diagnoses, they don't have a good way, they're not data scientists, if you will. So they don't have a good way to go through and effectively analyze all your different tests over time, and pull in, all the different things that you've been taking all into one place to try to actually give you a real concrete plan. And your average doctor doesn't really know that much about AI, at least not at this point. Now, like you said, in the future,
A lot of companies are in business now to help doctors and medical systems use this data and become more efficient. So, if you're a member of UCSF Medicine or Utah, I don't know what medical facility you're part of, they're starting to do that, but they want to keep you in their system, right?
Yeah.
They don't want you to go outside their system. But if I can charge you $10 a month to do all this, you'll be more informed than your medical system will be. You'll have all your data, and I'll just let you can just link out to them. You can still use them for your procedures and all your stuff, but hey, it's your data, not their data. It's your data.
Yeah.
And they're not going to use half the data that you use. And when you walk into them with all your data and all these tests, you're going to know more about yourself than they're going to know about you. And that's true whenever you go to your doctor. It's like you got to go to intake, and they got to pull up your record. Let me read your file. Oh yeah, I remember you. Right.
Well, it's and we innately know more about ourselves than our doctors do, and that's again another thing that can be a source of frustration for whether it's autoimmune or whatever, is that we know what's going on, and sometimes that doesn't match up with our
you know more about your car than your mechanic does, because you've got electronics and warning systems that go off. Lights, brakes, engine oil, transmission, right? Wiper fluid, right? So when you check engine light, we're gonna have a check engine light on this app. Not only when red flags come up, but when you're not behaving well.
Yeah, absolutely. I mean, it's like you know more about your car because you're the one driving it. You know more about your body because you're the one living in it. You know.
Exactly. Anyway, that's our story.
Cool, that's awesome. So anything else I didn't ask you that you want to share with anybody? And like I said, we'll link below to his Longevity Health website. We'll link to information on the AI program. And yeah, this has been a really interesting conversation. And, you know, we'll just continue to see where AI goes. And hopefully it definitely continues to help improve the health and diagnosis of autoimmune cancer and everything else. And
yeah, no, the only other thing we love is we're still open on some beta for the AI product, ai.longevityhealth.me. And, you know, sometime this winter, we'll be doing an investment round. So we'll probably be out there to Utah when it starts snowing to see some investors.
Cool.
Yeah.
Awesome. Yeah. I'm excited to see where this continues to go and how this continues to evolve and help people with their health. Because yeah, it's like you said, our healthcare system is insurance, government, everything. It's a big mess and we need help. So interesting to see
It's
where it
getting better.
goes.
Well, thanks for having me on.
Yeah, absolutely.